Good morning, everyone. We're here today at the airport in Wellington because under our plan, Kiwis will be able to fly. Today, I'm very proud to release National's plan, Opening Up. National's plan to tackle COVID-19, end lockdowns and reopen to the world. It is now 18 months since New Zealand closed its border due to the COVID-19 outbreak. When New Zealand shut our borders to the world, the Prime Minister described this as a temporary measure. But 18 months on, Kiwis don't know when the temporary measures will end. Around 1 million Kiwis are stuck overseas, cut off from their own country, their own families, for 18 months. With no time frame for when they can come home, New Zealand's elimination strategy did work, and it got us through the period when vaccines weren't available. But under our elimination plan, our government's debt almost doubled. And over the last 18 months, Auckland has spent a total of 17 weeks in lockdown. That is 17 weeks that kids haven't been able to go to school. That's 17 weeks that people have been isolated at home alone. And that's 17 weeks that businesses have been losing money. Elimination had its role, but now we need to vaccinate our way out of lockdowns and isolation. Labour is not being upfront with Kiwis. And on Friday, Minister David Parker was saying 90% vaccination and people can get all the freedoms back. Sunday, we had Minister Chris Hipkins saying he isn't latching on to particular numbers. And then on Monday, we had Prime Minister Ardern and Grant Robertson saying elimination is still the goal. Frankly, the government is all over the place. National knows that if we want people to come with you on a journey, you need to tell them where we're going. Kiwis have done the hard yards over the last 18 months to keep the country safe, and they'll now need to see that there is a plan to end lockdowns and reopen to the world. And National has prepared that plan. If adopted, National's plan means Kiwis overseas could come home to spend this Christmas with loved ones, or take an overseas holiday for New Year's. And before I announce the details, I want to thank the Members of Parliament and the hard-working National Party staff who have pulled this plan together over the last 6 weeks. This has been a team effort, a huge effort. Thank you so much for the work that you've been doing. And I also want to thank the experts who have reviewed our plan. A lot of hard work and research has gone into making sure every opportunity is covered. So let me come to the plan. National proposes that New Zealand both supercharge our vaccine rollout and massively enhance our contact tracing, testing and isolation measures to safely end lockdowns and reopen to the world. Pillar 1 of our plan is to invest, to set ourselves up to reconnect to the world. And under this pillar, National outlines our plan to supercharge our vaccine rollout, including going door to door in vulnerable communities, to use technology like saliva testing and rapid antigen testing to find more cases faster, to establish a new dedicated COVID-19 response agency, Te Korowai Kokiri, and to invest in hospitals, intensive care capacity and new COVID treatments. Our investment pillar is all about setting ourselves up to end lockdowns and reconnect to the world. Pillar 2 of our plan is evolve. Under Pillar 2, we evolve to a new approach of using technology instead of lockdowns. Pillar 2 is triggered when New Zealand reaches the milestone of 70 to 75% vaccination. And once New Zealand reaches 70 to 75% fully vaccinated, we can end nationwide lockdowns. With 70 to 75% fully vaccinated, we can end the economic and social damage lockdowns cause. Finally, Pillar 3 is to open. Pillar 3 is our pathway to reconnect New Zealand to the world. utilising the investment in testing, tracing and isolation and invest. And by reaching a milestone of 85 to 90% fully vaccinated, New Zealand can open to the world. Travelling under Pillar 3 will be new. Countries will be specified into green, orange and red zones. If you are coming from a green zone country and are fully vaccinated, you can travel freely into New Zealand. You simply complete a test before leaving and a rapid COVID test at the airport on arrival. Pillar 3 makes it possible for Kiwis to come home for Christmas or take an overseas holiday at New Year's. Orange travel will recognise that double vaccinated travellers pose less risk but still require 1 week home isolation and use of an app to check in daily. Red zone travel will be recognisable as a system that everyone is sent through today. Although with the majority not needing it, the backlog will be largely gone. Unvaccinated Kiwis will also need to return home through our current MIQ system. For green and orange zones, our immigration settings go back to normal. Students, tourists, workers can come back. However, non-citizens and non-permanent residents who are unvaccinated simply cannot travel to New Zealand. For non-citizens and non-permanent residents, it's no jab, no entry. Pillar 3 is not about compromising on health. Pillar 3 is about moving from an elimination strategy to a vigorous suppression strategy. We accept a tolerance for a low level of COVID in the community, but vigorously suppress cases when they occur. Through testing, contact tracing, isolation and quarantine, we know elimination cannot work forever. And it is only ever a strategy to see us through until this point, the point at which vaccination and technology could support a vigorous suppression strategy. So National's plan is clear, simple and comprehensive. Our plan provides a pathway for Kiwis to get behind. It shows New Zealanders a game plan to ending lockdowns and opening up to the world. Our plan is about providing a path forward and reconnecting New Zealand to the world. And if the government follows this plan, if Kiwis get behind this plan, New Zealanders will be able to spend Christmas with their loved ones rather than being stuck overseas. I will now pass to National's COVID-19 response spokesperson, Chris Bishop, who will touch on a few extra details of the plan and who has been leading the team on putting this plan together. Thank you, Chris.
Thank you, Judith, and can I thank Dr. Shane Retty, Simon Watts and Erica Stanford for collaborating with me in developing this very ambitious plan. On Monday, the Prime Minister said she was confident New Zealanders could enjoy a classic Kiwi summer. Most Kiwis regard summer as a time to travel and catch up with friends and family they haven't seen for a while. Grandparents who come back from overseas for a summer break to see the grandkids. The lawyer in London who comes home for a few weeks to escape the London winter and enjoy some beers at the beach with long-lost mates. And Kiwis who go the other way, who journey across the ditch to Oz, maybe to catch some cricket, maybe some music festivals. Under Labour, there is no plan to allow those things to happen this summer. The reality is that after 18 months of COVID, Labour doesn't know what to do next. The Prime Minister says they don't have a vaccination target. The next day, Ashley Bloomfield says they do, it's 90%. Prime Minister says one day she wants to reconnect to the world. Then Chris Hipkins says the very next day, everything's up for debate. They're rethinking everything. Today, the government is announcing a 150-person pilot for business people to self-isolate. It's pathetic. Is this really what we've come to as a country? 150 people 150 people self-isolating, plus running a lottery in human misery every week to see who gets the privilege of entering New Zealand through MIQ. It's like the Hunger Games, except it's not fictional. It's Kiwi citizens' lives we're talking about. We can do better, and under National's plan, we would do better. I want to expand a little on the details outlined by Judith. Pillar 1 of the plan contains a number of steps we think New Zealand needs to take in our health response. Vaccination is the most important, and we're putting forward 11 positive initiatives to supercharge our vaccine rollout. Yesterday was our slowest day in first dose vaccinations since early July. We've got to get the numbers up. We're still not using GPs properly. We're still not using pharmacists properly. The red tape is suffocating. We should be using GPs, and we should have been using them far sooner. John Tamahiri and the Waipareira Trust are doing a great job, but they can't access government data held by the DHBs, so they can go out and find those hard-to-reach communities. Let's give them that data and make sure that they can use it. Throughout the rollout, there's been a very top-down approach driven by the Wellington bureaucracy. So we propose establishing a rangatahi advisory group to actually ask young Maori how we can get them vaccinated. You know, sometimes all it takes to find a good idea is a bit of listening to the community. We need to do whatever it takes. Set up a vaccination clinic in Courtenay Place or the Viaduct. 2/3 of people in this most recent Delta outbreak who've got COVID are aged under 30. Go where they go, set up vaccination clinics and vaccinate them. Do whatever it takes. Find 10 economists, throw them into a room, give them a week, tell them to come up with the best ideas for incentives and then fund them. Some will fail, some will work. It'll still be worth it because every extra person we get over the line for vaccination makes a material difference to the future prosperity of this country. The government has no plans to vaccinate in schools before the end of the year. What a wasted opportunity. Let's get on with it as soon as possible. And while we're at it, we should mandate that healthcare workers in COVID-19 work streams are vaccinated. It's disgraceful that 9 months into the vaccine rollout, we still have healthcare workers potentially working on COVID patients who don't have to be vaccinated. Make it a rule, do it yesterday. You know, there should be an inquiry into saliva testing in New Zealand. It was recommended a year ago as an urgent priority by the government's own expert advisor, Sir Brian Roche. We should be using it daily for residents in MIQ and for our border workers. It's less invasive, it's cheaper, it's just as accurate as the nasal tests, and we should be contracting a surge provider for surge capacity testing when we have outbreaks. In the first 2 weeks of this most recent outbreak in Auckland, people lined up for 12 hours to get a test. Some people ended up on the line and gave up, they went home. And some people probably didn't even bother to get a test because they saw the lines and didn't want to bother. All the while, Rako Science can do 10,000 tests a day. They were unused by the ministry. A wasted opportunity. We should be doing regular saliva testing in our public hospitals like Middlemore, for example, as well. We need to end the ban on rapid tests in New Zealand. We should be using them for essential workers crossing the Auckland border right now. At the moment, people have to get a test every week. And as we know with Delta, it moves so quickly, it means you could get COVID, spend 6 days driving in and out of Auckland into the Waikato, have COVID, and not have to be tested. We should be using rapid testing on a daily basis for essential workers right now. Our aim is to have rapid tests ubiquitous in the community by mid next year. There's lots more I could talk about. The plan includes our proposals for purpose-built quarantine, which I see the Victorian government is doing in Australia on a very similar lines to what National proposed in February. We need a proper digital app for vaccine authentication. People are walking around carrying the little cards that they get when they get vaccinated. We should be able to show very quickly and simply on our phones that we've been vaccinated. We still haven't bought or approved any next generation treatments for COVID, some of the novel monoclonal antibody treatments that are showing huge promise, like Ronapreve. We are miles behind other countries that are ordering these treatments by the truckload and approving them increasingly. We have not ordered any, we have not approved any. We are miles behind the 8 ball in other countries. I'll soon hand over to Dr. Reti, but I just want to finish by talking about travel under national. Under 85%, it's game on. At that point, we will have one of the highest vaccination rates in the world. And I want to send a very clear message to Kiwis listening around the world today. I know many have tuned into the live stream. Many of those people watching feel alienated from their country, and led by a Prime Minister who said yesterday, MIQ isn't a lottery. My message to them is this: National values you. We know that Kiwis travel, and we know that you didn't ask for COVID either. We want you to be able to come back to New Zealand. National's travel plan allows that to happen. Fully vaccinated travellers in low-risk jurisdictions can come back without going into quarantine with a negative pre-departure test before leaving and a negative test on arrival. Fully vaccinated travellers in jurisdictions like the US and the UK be able to come home after isolating for a week. We would clear the human misery lottery that is MIQ in a week. National's plan allows Kiwis to come home and it allows Kiwis to travel. It's a comprehensive, ambitious plan for New Zealand's future, and we put it forward to the consideration of the New Zealand people, and we're very proud of it. Dr. Reti.
Good morning, everyone. The purpose to New Zealand's coronavirus response has been to keep New Zealanders safe and to protect the health system. We look to contribute to the discussion around what it means to protect the health system and the impact on health resources when relaxing community and border settings. These settings are similar to the current policy settings in the UK and Norway. No models incorporate all of the levers available for a coronavirus response. Some models have focused on border settings, some have focused on community responses, including public health measures such as masking, social distancing and lockdowns. Others have focused on system measures such as testing, tracing, isolation and quarantine. Using some of the models to make very broad estimates of health system impact around relaxing community and border settings, some estimates can be made. I would add that this is only a direction of travel and not a final destination. We do not suggest that policy settings wait until any new resource is built, but rather that further threshold analysis and modelling be undertaken around the impact on the health system, and that short, medium and long-term plans take into account requirements for human resources and capital resources as part of coronavirus management. We would note that as it has been in the current outbreak, human resources are likely to be the critical gateway, requiring policy settings at immigration and tertiary education levels. We can learn much from other countries as they relax their policy settings and what impact that has on the health system for them, that we might take that into account also. Thank you.
Well, thank you very much, Dr. Reti, and good morning, everyone. National's COVID-19 plan is focused on building a strong health system, and step 10 of National's plan, opening up, includes a strong priority on improving our hospitals and expanding our ICU capacity. It is shocking, but perhaps unsurprising, that we've seen a number of failures through the latest outbreak. Failures that show that this government were not ready, that this government were not prepared. National's plan involves urgently implementing a specialist healthcare workforce migration plan. We would select the 3,000 doctors and nurses out of the expression of interest pool and process them urgently. We would also prioritise and fast-track resident applications for critical healthcare workers, setting aside dedicated MIQ spaces if required. National would offer conditional residence class visas upon arrival to specialists, experienced nurses who have the qualifications and experience needed to immediately start working in New Zealand. We would also support migrant nurses already in New Zealand to complete competency assessment programs and also support them with examination fees where necessary. The other important element is to increase the healthcare student enrolment numbers at training institutions, to increase long-term labour participation rates and get New Zealand aligned with OECD benchmarks. Increased medical workforce would be dealt with by providing for more postgraduate year one roles within DHBs, and importantly, focusing on retention. And most importantly, we would also fast track the building of new hospital wards to increase bed capacity and ICU capacity. In Auckland alone, we're aware that there are business cases for projects that could be progressed immediately. And under National, we would get those going. National wants New Zealanders to enjoy more of the freedoms they have had before the pandemic hit. And to do this, we must make sure that our health system is robust enough to deal with the people that will fall ill as a result of COVID-19, but most importantly, to continue the day-to-day operations. I'll now hand over to Erica Stanford, Shadow Immigration Spokesperson.
Well, good morning, everyone. I'm really happy to be here today to help deliver National's plan and to help us reconnect to the world and provide certainty. Firstly, certainty, as we've already talked about, for those many Kiwis offshore, who, when we talk about the team of 5 million, very quickly excluded them and left them to the overseas, not being able to come back. And it created a sense of anxiety and stress and isolation for those people who are unable to come back to visit family, to see loved ones before they passed, and also attend funerals, all for medical reasons. We very quickly turned this into a great miserable lottery, creating more stress and anxiety for people who then saw that there were 20,000 people ahead of them in the queue. And then, of course, there's the other lottery of the emergency allocation system, which for many people has been incredibly stressful and difficult to navigate, with many declines where there should have been people being accepted. That will all change under this plan. Those people needing to get home for emergency reasons will not have to go through the emergency allocation lottery. Instead, will be able to get home to visit loved ones and for those emergency situations. This also has a huge impact on our migrant community, who we realistically have been treating like second-class citizens for the last 18 months, especially those who've been split from their families for the last 18 months. Those migrants who've been getting up every day, teaching our children, looking after our parents in aged care facilities, working on our dairy farms, trucking our goods around, working every day for the betterment of our society and our economy, and haven't seen their own children in 18 months. And that has been a stain on New Zealand that we have allowed that to happen. This plan changes that. It allows our split families to be reunited and reconnected in a safe way using our traffic light system. I'm really excited actually about the prospects that New Zealand has in terms of our health response and our economic response when it comes to immigration. This plan offers certainty to bring back and bring in our very important skilled migrants that will help get us out of the COVID economic mess that has been wrought on this country in the last 18 months, to help kickstart our economy, to deliver those skills that those businesses around New Zealand desperately need. Part of our plan is to fix our broken immigration system. We have had, or we currently have, years-long delays in getting residents. We've got long queues of misery. This plan today announced allows us to clear the decks, offer a fast-tracked process to residency, to firstly keep those valuable migrants we already have here in New Zealand, and secondly repairs our international reputation that has been so badly damaged over the last 18 months. We used to be a destination where skilled migrants wanted to come, but with a residency queue years long, that has all changed. So if we want to get the best talent into New Zealand, we have to clear those residency decks and create a fast-track pathway to residence so that they have certainty knowing if they bring their skills here, they can make this place their home. The second part of our plan to keep those valuable migrants here is to offer a pathway to residence for all of those essential skills workers working in New Zealand right now, who stuck with us through the pandemic, who are working on our dairy farms, trucking our goods around, working in our aged care facilities, that they have the certainty of a place here in New Zealand that would be fast-tracked. If New Zealand wants to be the best, and we need to have the best talent, we need the best immigration system possible. And right now, it is the worst immigration system, a broken immigration system that needs fixing. National has a plan to fix that system, to keep our valuable migrants here onshore, and to attract the very best talent from around the world. Thank you very much.